dependent on technology, one where people didn't look each other in the eye, where they were stuck in front of a screen for hours on end and felt lost and empty. He hated what he saw as our tech obsession. A devoted, lifelong gardener who also loved to cook for everyone as an expression of his love, he'd chide me as I kept checking my phone for work messages during my visits. "Nico, stop looking at that stupid thing and be here if you're going to be here." He had never heard the much-hyped word mindfulness. He had never read Be Here Now by Ram Dass. But he got it, better than most. He'd laugh when I'd tell him that parts of Greece were blue zones, known for longevity. That maybe he would defy the doctors and have many more years left to live, like his father who lived well into his 90s. "Nico, I don't know about blue or red zones. I know I live here now. But I also know that we lived a simpler life then, a more human life. All this nonsense today, it's not the way people are supposed to live." He had grown up in a tiny and remote mountain village in northern Greece during the 1930s and 40s. There was no electricity, no indoor running water. It was a cold and Spartan existence. Yet he would talk about his childhood, at least before the Nazi invasion, as a special time of peace, joy, and a profound love of nature. The trees he planted in his village as a boy still stand today as towering living examples of his symbiotic relationship with the natural world. He nurtured nature, and nature nurtured him. People did work hard, but there was a purposeful pace, not the frenetic and chaotic cacophony of modern city living. And the values were different. Genuine relationships were more important than things like money or the right car. I began to wonder, yes, while we often tend to idealize life in the past, if maybe there was some merit to what he said. After all, for the past decade, as both an author and a psychologist, I had written about the impacts of the modern age on our deteriorating mental health and run clinics around the country treating all manner of psychiatric and addictive distress, issues that only seem to be getting worse. And I had spent the last few years trying to better understand a simple conundrum. Why is our mental health deteriorating as we become a more technologically advanced society? After my dad died, I began to realize that his life may hold many of the answers to the modern problems I was trying to better understand. Why we're so sick and getting sicker. And make no mistake, we've become a very, very sick society. While we lose ourselves in the digital masturbation of Candy Crush, Instagram, and YouTube kitty videos, we're dying in record numbers. More than 200,000 people, mostly young adults, died in the United States in 2019, before COVID, from psychologically driven deaths of despair, suicide, overdose, and alcoholism. Add the record rates of loneliness, anxiety, depression, extremism, political unrest, and mass shootings, and you have the telltale signs of a society on the brink. Post-COVID, those numbers and volatile dynamics have only gotten much worse. What's happening? The answer is that humans simply aren't genetically designed for technologically driven 21st century living. We aren't meant to be sedentary, screen-staring, atomized, and meaning-devoid beings. The unfortunate reality is that modern life is antithetical to our hunter-gatherer psychological needs. We are hardwired for face-to-face community, genetically designed to be physically active, and psychologically primed to seek meaning. But the digital age is kryptonite to those sanity-sustaining needs. We're all living in a world gone mad, driven insane by a digital rat race of overworked, underslept, cubicle-confined, sensory overloaded, lonely, meaning-devoid, overstressed people who are perpetually turned on and plugged in.